In this video, I'm going to show you why a normal cholesterol test is worthless in assessing your risk for heart disease, compared to these two proteins and their ratio. This one blood test I'm going to share with you is the same test I've shared with my private nutrition group, and it has helped them better assess their risk instead of going off the standard cholesterol test we all get from our doctor. I'm going to go share it with you right now. These two proteins called Apolipoprotein B and Apolipoprotein A1, when evaluated together, are far better at predicting heart disease risk than the standard cholesterol test. An ideal ratio of these two markers is between 0.3 and 0.9, which can be achieved with a relatively high ApoA1 and a relatively low ApoB marker. Research is clear that the higher the ratio of these two markers, the greater a person's risk for cardiovascular disease. Fortunately, there are better lab tests like this one to evaluate your risk. However, your doctor has likely not heard of all these tests, and you'll have to request them. So here's what we need to do to reduce your risk for heart disease. Right now, we're going to do this. We're going to click the button, and on the next page, you're going to sign up for this webinar where I'm going to share with you 4 other blood tests. I will go into detail on each blood test and what each one is measuring to ensure you have a complete picture of any heart disease risk. One of these tests can actually tell you if you have an inherited risk factor for heart disease. Click the button right now to learn which test you need to ask your doctor to order.